you cannot get that level of care in any other institution, right? So let's say if you are a patient in the ward, medical students are going to come early in the morning and they are going to take your history and examine and they are going to manage. So they are going to ask you everything. They are going to ask everything from the patient. ගෙදර ඉන්න කවුද ගෙදර බල්ලෝ ඉන්නවද එලා වෙජිටේරියන්ද ඊළඟට ළමයි කී දෙනෙක් කියලා ළමයි හම්බුනේ සිසේරියන් එකකින්ද ළමයිගේ වයස කීයද ළමයින්ට මොන හරි ලෙඩ තියෙනවද ඒවත් අහනවා right we have to ask social history we have to ask right so it's a very low there's a very low percentage of missing anything right so if we find out anything we are going to tell our seniors then the house officer is going to come sort of the resident of the ward එයා ඇවිල්ලත් අහනවා short history එක එයා ඇවිල්ලත් ward round එකක් ඊළඟට අපි එයි ඔක්කොම යනවා there's a registrar කියලා කෙනෙක් ඉන්නවා a bit above right so the registrar is going to go ward round as well right ඊට පස්සේ sir එනවා the consultant comes around 10 දැන් ඉන්න sir නම් 8:30 වෙද්දී එනවා right so we have to go be there by around 7 so then the consultant comes and the consultant goes the ward round right he is going to again do the examination and the management everything and the investigation මොනවාද කරේ ඒ ඔක්කොම බලනවා එයා so sometimes the consultant comes in the evening as well house will ward round එකක් right so the consultant is going to look at the patient at least once and the registrar that is the second in command is going to look at the patient at least twice house officer that is sort of the junior doctor in the ward is going to look at the patient at least 10 times a day right and the medical students are going to go through the patients at least once or twice right so that is the amount of care but the thing is it's crowded and sort of the cleanliness is a bit low that is like directly proportional to the crowding right but that's the case so that's a good system based on sort of the let's say medical education and medical occupation it's very connected so the consultant sometimes comes just to teach right he can go and do a private practice any way he likes because he's the consultant he has no one to challenge him අවද ward round ගියාද කියලා කවුරුත් අහන්නේ direct ඇවිල්ලා so he can do a private practice from early morning to the evening but the consultants come to the ward and they go the ward round and they teach because they are sort of in that loop they learned that way so they are going to teach that way it's like that so it's a very good system that is sort of we should try to maintain for the